It is indeed my pleasure to now give the floor to the International Goodwill Ambassador of UNAIDS, Her Royal Highness, the Crown Princess Mette-Marit of Norway. Your Highness, you have the floor.
President of the General Assembly, Secretary General, Excellencies, distinguished guests, members of civil society, ladies and gentlemen. Good morning. Thank you for inviting me here to speak today. It's a great honor. The event today is indeed very important, and it addresses issues that affect the daily life of millions of people all around the world. Ending AIDS is of fundamental importance if we are to safeguard human rights for all. For many people, it is a question of their basic right to life and right to live in dignity. Combating HIV/AIDS is vital to creating healthy societies that can grow and prosper. We need to finish the unfinished agenda for MDG 6, and we need to maintain a strong focus on health beyond 2015. As UNAIDS Goodwill Ambassador, I have been privileged to support the AIDS response and human rights issues for many years. It's been important for me to engage with young people affected by HIV, to listen to their experiences and support them in their work. I would like to advocate that young people should be better included in forming policies. The world currently holds the largest generation of young people in history, as many of you know, with 1.8 billion adolescents and youth making up 1/4 of the world's population. In sub-Saharan Africa, more than 40% of the population is under 15 years old. Despite this, young people's health and needs remain largely ignored. While we can celebrate recent progress in the response to HIV, young people are being left behind. Every day, there are 2,100 new infections among young people between the ages of 15 and 24 around the world. In sub-Saharan Africa, only 36% of young men, and even more alarmingly, only 28% of young women are able to demonstrate comprehensive knowledge about HIV. While HIV mortality is decreasing in all other age groups, it remains the second biggest contributor to adolescent mortality globally. HIV testing and counseling is the critical entry point to the continuum of care for adolescents living with HIV, yet the majority are still unaware of their HIV status. In 9 of the world's highest prevalence countries, less than 20% of young boys and 30% of young girls have been tested and know their status. Various factors contribute to this situation. Stigma and moral and social judgments on the part of communities and service providers have a negative impact on young people, particularly young people living with HIV. Stigma and discrimination undermine our efforts in the response to AIDS. When managing the health and well-being of young people living with HIV, their sexual, reproductive, and other human rights must be a key focus. We should take a holistic approach to prevention and treatment and work to promote both simultaneously. It is clear to me that we need to continue to invest in leadership of young people. Young people have in-depth knowledge of the challenges in their own communities and are often able to establish contact with those who are hardest to reach. In my own work, I focus particularly on empowering young people and supporting the development of leadership skills. And I am proud to say that over the past few years, we've seen an incredible expansion of the youth movement in the AIDS response. A strong international group of youth leaders have formed the Pact for Social Transformation, a coalition of 25 youth organizations working together, better organized than ever before. They are linking local and global level advocacy for treatment scale-up. They are addressing the legal barriers and policies that prevent young people from accessing services in many countries, and they are working to assure that there is a commitment to ending AIDS in the post-2015 era. The AIDS response is in many ways unique in that civil society movement to a large extent drives it, in the unprecedented resources it has mobilized, in the multi-sectoral partnerships between scientists, activists, communities, and the public and private sectors, in its effective advocacy for change in public policies, and most importantly, in the impact it's had on delivering health, welfare, and human dignity to millions of people. Activism has changed the way health services are delivered. It has shown that tackling the determinants of HIV, risk, poverty, and vulnerability is the key to healthier and more secure societies. Across the world, and in the case of high-burden epidemics in particular, we have seen a drop in the number of new HIV infection. This tells us that sustained evidence-informed prevention programs, which address the immediate as well as the social determinant of risk, are having an impact. Now, more than ever, no one should be left behind. We cannot afford to allow the global AIDS response to lose its momentum. We need to maintain a strong vision, to remain committed to our ideals, and be decisive in our actions. Ending the AIDS epidemic is possible in the post-2015 era, and it is indeed an issue of human rights. In closing, I would like to quote Eleanor Roosevelt, who once said, "Where, after all, do universal human rights begin? In small places, close to home, so close and so small that they cannot be seen on any maps of the world. Yet they are the world of the individual person, the neighborhood he lives in, the school or college he attends, the factory, farm, or office where he works. Such are the places where every man, woman, and child seek equal justice, equal opportunity, equal dignity without discrimination. Unless those rights have meaning there, they have little meaning anywhere." Thank you.
I thank Her Royal Highness for her statement.